Good evening, everyone. It's Dr. Hudgens. I have read your discussion boards from last week and have posted feedback in the associated rubric for your review. This was an interesting idea for you all to be thinking about. We think about traditional learning in the rote memorization world where many of us, if you've been a nurse for as many numbers of years as I have, about 23, my nursing program was heavily weighted on memorizing facts, memorizing parts of the body, memorizing medical terminology and drug cards. I had stacks and stacks and stacks of flashcards. There was so little emphasis on critical thinking that it really now seems like an afterthought to my education, especially in my undergraduate work. So I was really interested in what your thoughts were about that and what you got from your assigned reading. Your classmate Jennifer, I think, did an especially good job of kind of wrapping up the concepts together. Jennifer wrote that in Titus chapter 2, verse 1, it says, "You, however, must teach what is appropriate to sound doctrine." This can be applied to the educational setting. When designing lesson plans and developing curriculum, nurse educators must consider the variety of students' learning needs and subscribe to a theoretical and educational framework that incorporates diverse teaching methods, including both rote learning and critical thinking. Subscribing to a theoretical framework for educational practice is necessary to be an effective educator and helps Christian educators use their gifts of teaching to fulfill his plan. I think that is a beautiful way to really bring in the Christian worldview into our role as educators and reminding us that it really is important that we use sound teaching practices to help the student arrive at the desired outcome. If you're teaching a medical terminology course, then rote memorization is probably appropriate. If you're in a skills lab and you're teaching basic sterile technique, you want your students to remember what the basic steps of sterile technique are. But you also want to dovetail in the critical thinking piece of when I've missed a step in sterile technique, what are the risks to my patient? Am I accountable to stopping what I'm doing and starting that procedure over again despite being uncomfortable or embarrassed that I've made a mistake? It is so important that we understand that using, as Jennifer said, the right theoretical practice and framework to guide our teaching is most essential for our students to have the desired outcome. So I appreciate the thoughtfulness in that analysis. From an APA standpoint, you guys are in really good shape. The only thing that I want to warn you about is to make sure you understand that at a graduate level, you should not be using direct quotes unless it is an exceptional quote that cannot possibly be paraphrased or rewritten differently. That's an outlier. As a graduate student, you should be able to read concepts that are written by an author, think about what they mean, paraphrase them, and then connect it to the body of work that you are writing as an author. Basically, you're telling me the so what factor of that author's work. Why are you citing it here, and how is it relevant to what you're talking about in your paper that you're writing? You're going to try to make every effort to not use direct quotes so that you can be successful in that. Your assignment for next week is to develop a draft of your goals and objectives. I want to remind you that your goals and objectives at this point are going to carry you through 618, 619, 620, and to graduation. So the recommendation is you have 4 to 6. My suggestion would be that you lean closer to 6 so you'll have enough robust work to keep you busy without having to do a revision prior to 620 coming to a close. You're going to have to really be intentional to plan kind of what the next 3 8-week sessions look like. When you do your goals and objectives, I want to remind you that you're going to use the NLN competencies for the writing of your work. I don't know if you may have an electronic version, but if not, your book should look very similar to this. Get the glare out. There we go. Nurse Educator Competencies. This book should be used when you're writing your goals and objectives. It should be cited in your reference list at the end of those goals and objectives. So know that I'm going to be looking for that. I think that's pretty much it from a next week planner standpoint. If your draft version of your goals and objectives are adequately done and only need minor polishing or minor changes, you may be released to start your practicum. And as soon as I post your feedback, you'll be able to go in and see if you have the green light. If you do not, you're going to need to, everyone's going to have to submit a final version for a final grade in week 3. The question is, next week, are you going to be able to use the draft and be able to go ahead and start your clinical hours? And all of that will depend on your intentional efforts to do a good job and to have a solid plan for your goals and objectives. So know that that will be out there. If you have questions or concerns, email me directly, or if it's a general question, you can use the Ask the Professor link that's posted in the discussion boards. Know that I'm here. If you go through your feedback from this week for your discussion boards and you're unsure what I meant by a comment, or you have additional questions or concerns, I know that online learning feels like you're supposed to be on autopilot and doing things on your own. It's okay to ask questions. I'd rather you ask questions and have clarity in what you're doing than make mistakes that cost you either in your grade or in your academic outcome. So know that I'm here. Know that I'm praying for your success. I hope that you guys have a great week. I will look forward to seeing your goals and objectives, and then we'll see what the next week brings. Y'all take care.